Imagine your heart racing, your hands are shaking, and all of a sudden you start to feel like there is impending doom. Something is wrong, but nothing is actually happening to you. There is no danger, no threat. The question remains and begs, why does this happen? And why do some people present to the emergency room with such symptoms? So, in this episode, we'll be talking about what the biology, what are these feelings, how does the mind work with regards to this, and what happens in the brain. Welcome to the first episode of the Medical Mind podcast. I am Dr. Mohammad Almoataz, and today we'll be discussing and exploring what anxiety is. As doctors and as people, we all want to know what happens. So, anxiety is not a weakness. In fact, it's a biological response designed to protect the human body. It is the feeling of danger when there is no danger. So sometimes you might be having just a slight panic attack, or you might think, but in reality, you might fulfill the criteria for anxiety, generalized anxiety disorder. So, in anxiety, the same systems that happen during a real emergency, imagine that feeling when a dog is chasing you and you have that rush of heart rate and that palpitation and the sudden sweating and the need to get out of the situation. In other words, the fight or flight system. It's the same systems that get activated. But the only difference is in the first one, you have a dog chasing you. However, during an anxiety attack, there is no dog. It's just you feeling that. In anxiety, also, there is an overactivation of the system that leads to this panic attack or this panic response, in a better wording. Why do we have it? That is probably the question you've been asking. And in the past, we used to live with snakes, animals in the wilderness. It's not us, our grandfathers, during times of wars and during times of famine. Those responses were designed to help us. However, in today's day, we don't have much real threat. There are obviously threats. However, the threats have reduced or changed. One new threat we might have is the loss of a job. And the other thing is exams. Exams were never a part of humans' culture when it came to studying. However, in the past couple of years and centuries, it has been incorporated into our system and into our society. So the brain did not evolve that much. It's probably the same as it was back then. But the threats have changed, as I've said earlier. Now we have exams, bills, responsibilities, relationships, job stress. Relationships used to be quite different from today's relationships. Our bodies are ancient, however, our world have become modern. That's the conflict of anxiety within the human body. So, what happens inside the brain? Let us walk through it one by one in order to understand it better. So, in your brain, you have a specific area that's called the amygdala. This amygdala is there for expressing emotions and is the first part of the alarm system. When it detects danger, it fires within the brain. And then this sends a signal to the body. How does it send it? Through a part of the brain called the hypothalamus. And then this response to the body first reaches the brainstem, which is another area within the midbrain. And this increases the heart rate and the breathing rate. So, in other words, you start to be tachypneic, as we say it in medicine, and tachycardic. And the other response is that it sends it down to the adrenal glands, where you have the cortisol and adrenaline being released. One is the stress hormone, and the other is also associated with stress. However, it's more associated with the fight or flight system, thus giving you that response of the fast heart rate, fast breathing, sweating, fear, your pupils get dilated, the sympathetic system gets activated. And finally, when you have struggle and have a very traumatic experience, such as let's say you have an exam that you failed horribly and you have that replay in your mind. Why does that happen? Because all of this is stored within an area within your brain called the hippocampus. And this hippocampus is quite interesting because it looks like a seahorse. Now, the biggest problem to all of this is that the amygdala can become too sensitive, so it might send false alarms. You get that feeling when sometimes you're quite engaged in something and it doesn't go quite well. What happens is that you start to over express yourself and be quite uncomfy. And this is partly due to the effects of the amygdala. And when we have that, the other symptoms start coming one after one. Number one, you have the racing heart, the sweaty hands, the tunnel vision, the dilated pupils. You feel like something bad will happen at the moment, and that feeling of impending doom. the I might die effect. It's not your imagination. This is frankly all associated with your biology. Now, let us take a small case that I think will send it home to most people and physicians. So you have a 26-year-old woman who comes to the hospital at around 1 a.m. Her heart rate is quite high, 140. Her blood pressure is 160 by 90, and she says the following: Doctor, I think I'm having, or I'm suffering, or I might die. So the first response you will have is, oh, I need to do something about this. She might also say that she has chest pain. So you'll be sending for ECGs, you'll send for labs, and you might want to send for troponin levels to check if the heart is affected or not, and you might start her on oxygen. But after doing all of this, all of the tests come out as negative, which is normal. And with oxygen and without oxygen, her saturation is maintained. Those numbers you see on the vitals machine. And that's when you have that thought that this might be something else. It might be a panic attack, which is a sudden intense anxiety episode. And usually, with that, what you can do is you can make the patient relaxed and you'll see immediate relief. And however, as a doctor, you should not always think that it might be a panic attack. You have to also investigate for other things. So, for instance, you might want to investigate if the patient has a thyroid problem. So, you'll be sending for thyroid hormone profile. And you want to examine if the patient has any history of drug abuse. You know, sometimes you might be given something or take something accidentally without knowing, and that might be a reason why you're having those symptoms. Sometimes students take stimulants for focusing and to get better grades during exam periods, and stimulants might also cause that. For instance, you have caffeine. Okay, and sometimes it might just happen due to a trauma. So somebody suffers something, and then when they go home, they see their legs bleeding or something, and they get that very impending feeling of doom, as I've said before. Then this patient, after everything comes out as negative, tells you that, doctor, if everything is normal, then why do I feel like I'm dying? So what should your answer be? Most probably the best answer would be is because your brain thinks that it needs to protect itself, and you might feel like you are weak or not normal, but in fact this is normal and it's a biological response, and biology cannot be easily controlled. So what are the symptoms you should be watching out? Number one is palpitation, chest tightness. The patient will tell you that they feel like they're feeling their chest is tight. You might have a headache. You might even suffer nausea. You might feel nauseated. You have cold or sweaty hands. You have muscle tension and difficulty in breathing. These are the physiological responses and symptoms. However, the psychological ones might be slightly quite different, where you have the fear of losing control, overthinking, insomnia. You might avoid social situation and you want to be in your place. And sometimes some people have derealization, wherein they feel they are disconnected from their reality. What is important is that anxiety has a spectrum. It might be mild, moderate, or even debilitating, which is severe. Treatment usually are given based on the severity. For mild cases, you might want to just make sure that the patient is well before discharge after doing all the labs, and the patient can be sent home. For more severe cases and moderate cases, you might want to refer the patient to a psychiatrist. So how to control anxiety using science-based evidence? The first line, obviously, and real scientific tools that have proven good responses, number one is the exercise. Exercise helps negate those feelings. So because it releases endorphins and reduces the effects of cortisol on the long term. Therefore, it helps with those feelings. The second thing is regular sleep. People who have insomnia usually have higher risks of developing panic attacks and anxiety, so you might want to get that in check. Try to sleep between 7 and 8 hours daily, depending on your needs. Reduce caffeine, even during exams, and I know that might be quite difficult, however, it's something you might want to consider. Journaling, sometimes you have certain thoughts about yourself or about the world, and therefore you're not able to relax. So jot them down, and this has been proven to help reduce the anxiety. Now, let's say all of these medical managements have failed. Therefore, you might want to consider consulting your doctor again and aiming for pills or more advanced treatments. You can start with the CBT. Basically, this is a cognitive behavioral therapy treatment wherein you learn how to navigate your thoughts. Then psychiatry referral. This is very important. As we've said earlier, that moderate anxiety and severe anxiety needs to be referred to a psychiatrist to help manage it, so the patient doesn't keep presenting to the emergency room and feeling worse about themselves. Number three, medications. And these are usually prescribed by a psychiatrist, and in this instance, they are SSRIs, selective serotonin receptor inhibitors, like sertraline. And it depends on the patient. If those fail over a course of 4 to 6 weeks, then they move to another treatment regimen and they try to navigate through all of them until your anxiety is controlled. So never be ashamed of taking treatments. This is a point that needs to be hammered home. Why is that? If a patient suffers from diabetes, then they should take insulin. This will help their long term. If you have anxiety, it's the same thing. It's something biological and you might be more prone to it. So therefore treatment is indicated. There are certain scores that they use. One of them is the GAD-7 score. You can do this online, and if you score above 10, then you have a possibility of an anxiety disorder. However, if you score above 15, then you might want to require a medical evaluation. You might have something else that is causing your symptoms. To conclude all of this, anxiety is not the enemy. It's a messenger. It's your brain telling you, I am overwhelmed, I need attention, I need to get my things down properly. Your goal is not to stop anxiety. Your goal is to understand it and gain control over it, and then you will feel better about yourself. And never be afraid of seeking help, because help at the right time will help you. If you keep postponing it and thinking that there is something only wrong with you, then you might have the potential of suffering long term. So if you've liked the contents of this video, then please like and subscribe to my channel.